Many people, in fact, most of us in our patients, will live to be around 100 years of age. And when it comes to living that long, no one wants to live in a nursing home from 80 years on. And it really comes down to three things: vision, memory, and mobility. If you know who you are, where you are, what year it is, you're able to get around, you're healthy, even if you're 140. So this morning we're going to spend a little time looking at nutritional support for focus and memory. A man's real possession is his memory. And nothing else is he rich, and nothing else is he poor. When we look at brain nutrients, there are many in the medical literature that brain nutrients can help support memory. So we're going to look at some or all of these, but it's amazing. All of these have significant documentation that they can help with memory. If we're going to just choose one, probably that would be DHA. The brain is made mostly of DHA. The brain is 70 to 80% fat, so we are literally all fat heads. We are. We want to make sure that there's enough good fat that's there, and the brain contains the highest concentration of DHA in the entire body. In the brain, the areas that are related most closely to memory, those have the highest concentration of all. DHA also helps protect the brain from damage because it prevents inflammation, it stimulates physical changes that underlie learning and memory, and it promotes healing after injury to brain tissue. It also promotes the development of anti-inflammatory molecules in the brain cell membranes, promotes the outgrowth of neurites, promotes rapid signaling transduction across the synapses. So a lot of different functions. Right after injury, DHA, the cell membranes release it in large amounts for conversion into protectants. Even with children, if they're deficient in omega-3 fatty acid, there's an increased risk in learning disabilities. People always ask me, when should you begin an anti-aging program? My answer is before you're born. Before. Because we know that women, when they're pregnant, if they take omega-3 fatty acids, their children have less ADD, less dyslexia, and a higher IQ. In this study, senior citizens eating fish once a week decreased their risk of memory loss. Also, EPA and DHA have been shown to decrease the deposition of beta-amyloid plaquing and reduce oxidative damage. Low levels of DHA are an increased risk factor for Alzheimer's disease. In this trial of almost 2,000 senior citizens that lasted for 10 years, Alzheimer's disease was 67% more likely to develop in people who have DHA levels in the lower one-half of distribution. We could go on and on and on and on and on and on. You get my point. It's really amazing when people tell me that there's nothing in the medical literature whatsoever that supports nutritional ideas and supplementation for memory. How about patients that are vegetarians and vegans? They can supplement with algae-derived DHA, which increases DHA levels in the serum, RBC, and platelet DHA content. So there really is an answer for everyone. In this clinical trial, there's an increase in serum DHA of 246%, platelet DHA of 225% with an algae-derived DHA. So even the patients that are vegetarian and vegans will have a